Hello, friends. Welcome to your weekly motivational moments with Eric Vickery, president of coaching at All Star Dental Academy, and my dear friend and my fellow coach, hygiene coach, Lynn. How are you, Lynn?
Very good. Thank you, Eric.
Good. We're going to talk about what it means to be a hygiene driven practice. What does that mean to you?
Well, I'm glad you asked that question because your hygiene actually, uh, 30% of your production and about 60% of patient appointments for the dentist appointments come from hygiene. So it is a cornerstone and a backbone of your practice. So it behooves us to look into it.
Mm,
Okay, so first thing
hmm
we have for a hygiene driven practice is a focus on vision, the vision of the practice. Next, a hygiene driven practice retains patient because patient retention is
mm,
important for patient growth. Your hygiene patients allow you to grow your practice. Next, it has the support of a dentist with skillful leadership. And that means
mm,
that you're aligned with your team. And then it also is composed of your hygiene team that is a highly functioning and highly productive hygiene team that is also compassionate and and productive. And the
mm.
next thing you want to have is
Yes.
you want to implement systems. These systems actually provide a high level of patient care and productivity for your practice, and also apply measurements for the growth and sustainability of your practice. Now, when you implement
Your
this,
KPIs. Yeah.
yeah, your KPIs, when you implement this, you don't just elevate the the care and health care of your patient, but you also drive the growth of your practice.
I have a question for you about this. It's a good outline. I know this is from your hygiene coaching outline on how you
Correct.
support our clients with the hygiene driven practice. I recognize this outline now that you're going through it. So, retention of patients. So, when you say that, give me a number, like a percentage or a figure. How do we, and maybe how do we know if we're retaining them? That's such a deep, deep topic, I know. But
Yeah, I
is
know.
there any clues you
Yeah.
can give us on like, are we trying to keep 100%, 95%, 90%? I
Well,
don't even know what that number would
90%,
be.
85% of your patient should be retained. And you want to make 100% of your patient with a recall appointment. If you can do that, that's a
Okay.
success.
Okay. So reappoint, we're at an appointment today to reappoint them. We want our targets 100%. Totally agree. Got that.
Correct.
Okay. And then our goal is 85 to 90% of retention. So let's do some quick math. So if you're seeing one hygienist is seeing about, we'll average it. We'll just guess a little 100 patients a month. There's potential that you could say 10% of them are falling off the schedule and need to be followed up on. That's 10 patients a
Just 10
month,
patients.
maybe
Correct.
12 if I'm, yeah, 10 to 12 patients a month. So that means we also have room for 10 to 12 patients a month for every one hygienist you have in your practice if we're not retaining all of them. Is that fair?
That is fair. And that means that you have room to grow.
Okay. Yeah. I talk a lot about you're losing, and maybe I need to fix my number. You lose about 8 patients a month, but it could be more than that if we don't have good systems in place. So well, second to last point here, implement systems, your standing operating procedures and your KPIs.
Mm-hmm.
I'm
Mm-hmm.
guessing a part of that is really your overdue hygiene system as well and how you're working that.
Exactly, exactly. And when you look at your KPIs, I know a lot of people are kind of leery about perio, but your perio percentage actually affects several KPIs. Your perio percentage is
Mhm.
actually a lead measure that affects your production per patient, production per day, and even broken and open hygiene appointments that affect
So what's
your.
the
But
minimum on that KPI? Oh, sorry. Quick question. What's the minimum percentage that you want in perio percentage for a practice?
okay, so the benchmark is about 30%. But, because according to the ADA, that's 47% of the population 30 years and over have perio, okay? So with the benchmark would be around
Okay.
30% in your practice. Now, depends on where you are at, and unless you probe everybody
Mm-hmm.
at every appointment, then that's the only way
Uh,
you know how much percentage.
Okay. This is a good just awareness for us this week. Next week, we're going to talk about how to take the steps in doing this. So we'll do some more on the second session of this. Thank you, Lynn, for joining me this week. Everyone, go out and make sure that you know your KPIs, that you know your vision for your hygiene, and how you doing with retention and perio percentage. Let's look at those. And then next week, we're going to talk some more about this. Thank you, Lynn.
Thank you.